Welcome back to Living 808. In today's segment, we're focusing on early childhood mental health. So we've invited Nancy Creedman from the Domestic Violence Action Center and Aaron Lacerdo, Executive Director from the Association for Infant Mental Health in Hawaii. Thank you guys so much for being here. Really appreciate it.
Thank you for having us.
I'm going to ask this question first because I know a lot of people, they may know, they may not know, but Commit to Keiki. Can you tell us what that is first?
Yes, Commit to Keiki is a non-partisan, statewide, collaborative effort involving community-based organizations, elected leaders, government leaders, foundations, community allies, looking at the impacts of various issues on children and their families, young children and their families. Hawaii is ranked 7th from the bottom in investing in Keiki. And Commit to Keiki is working to advocate and educate around the importance of better investment, better policy, and efforts to support young Keiki and their families.
I know you are so busy. Thank you so much for all the work that you've done. You've been on our show a bunch of times. Aaron, this is the first time I get to talk to you, so let's ask you some of the issues that you're seeing when it comes to Keiki and mental health issues.
Well, I think one of the things that is really important for us to remember is that in the first 1,000 days of life, children are really developing a lot of the brain connections and the relationship patterns that they'll be using for a lifetime. So a lot of times people think like babies are just going to be good all on their own, that they don't really, that they're just going to be okay. And in reality, we really do need to spend some intentional time and energy and effort to ensure that those brain patterns get set up really in a healthy way. It's estimated that 29,000 children in Hawaii under the age of 5 may be in need of some mental health supports, and that can look very different for every child. And there are a lot of children as well who are in our early child care and learning settings in particular who really are under the care of different providers. And so those providers, as well as parents in the community, really are the first people to create relationships for these babies. And what we sometimes kind of don't recognize is that the mental health of the caregiver, whether that be a biological parent or the provider, is critical to the development of the mental health of the baby or the child in their care.
There's been so many things that have changed since we were kids. It's so important. It's my understanding that there was a bill, or there is currently a bill, to create an infant and early childhood mental health program by the Department of Health. If passed, what will this mean for legislation for Hawaii?
The purpose of Governor Green's bill is to create an infant and early childhood mental health program. And that program would include consultation services to help support some of the different state programs that are in the communities that we have. It would service children birth through age 5 and the providers who care for them. And this could be in home visitation, early intervention, and different child care settings as well. And so a lot of the different philanthropic organizations have provided support to provide these types of programs to communities, and it's really wonderful to hear that the state is going to be investing in that.
Okay, Nancy, back to you for a second. Family violence.
Yes.
What kind of effect does that have on children's mental health?
Children are impacted in a variety of ways when they live in an environment that's defined by terror and torment. They can have sleep disorders, eating disorders, attachment disorders, attention disorders, behavioral disorders. They carry with them the experiences from their family of origin, living through, trying to cope with, and try to incorporate ways of understanding the fear that they're living with. They carry that with them into childhood. They carry that with them into adulthood. People bring themselves with them wherever they go, whether it's to child care programs, preschool, elementary school, or the workplace. So as a community, we really have to recognize that what happens in the home impacts adults and babies.
Would you guys do me a favor for our viewers? Would you give me a website or a phone number to call for more information for either of you or both of you?
Commit to Keiki website is www.committokeiki.org. Domestic Violence Action Center, where I work, is www.dvica.org. www.domesticviolenceactioncenter.org.
And we can be reached at the Association for Infant Mental Health, www.aimhi.org.
There you go. Thank you guys so much for being here. I appreciate it. That information, of course, will be on our website on k2n2.com shortly after the show. I really appreciate you guys being here. Thank you.
Thank you.